This conference will now be recorded.
Welcome everyone to our virtual town hall for Friday, May 8th. Our topic today is information on COVID-19 testing. We do have four individuals from our hospitals and Heather Metter with Linn County Public Health with us. So I'm just going to go through very quickly and let them introduce themselves. I'm going to start first with Dr. Leslie Greenlee with Unity Point Health. Leslie, would you like to introduce yourself for our attendees today?
Hi, my name is Leslie Greenlee, and I am a pediatrician with Unity Point Health.
Thank you, Leslie. Julie, would you go next, please?
I'm Julie Bear, and I'm the Director of Operations for Laboratory Services in our Unity Point Health Cedar Rapids region.
Okay, and I'm going to have Heather go ahead.
Hello, I'm Heather Metter, and I am the Clinical Services Branch Supervisor for Linn County Public Health.
And Dr. Ockett, would you like to introduce yourself, please?
Hi, my name is Matthew Ockett. I'm the Medical Director of the Emergency Department at Mercy Medical Center, Cedar Rapids.
Okay, and I believe we have Stacy on the phone. Stacy, could you introduce yourself if you're here?
Yes, I was able to get on. My name is Stacy DeMoss. I'm the Infection Control Manager here at Mercy Medical Center in Cedar Rapids.
Great. So I would just like to thank all of our panelists for being here today to answer some questions about COVID-19 testing. I know that this is something that we at Public Health have received a lot of questions on, and we know that our medical community has as well. So I am just going to go right into getting started. So today's format is a question and answer. So there was an opportunity for people to submit questions ahead of time. So we're going to go ahead and ask those questions, and our panelists will do the best that they can to answer them. If you do have a question to submit, you can use the chat function within GoToMeeting, or you can email that to lcph.meetings@linncounty.org. I am the one that receives those emails, so feel free to email them during our call, and we will get to those questions as soon as possible. I also did announce before I started the recording, but this meeting is being recorded and will be posted publicly. Only the audio portion and the visual portion of the recording is shared publicly. Anything you chat into the chat box is not shared publicly on that recording. So we do have a handful of questions that have been submitted in advance. Our first question is in regard to the large day habilitation programs for the intellectually disabled in Cedar Rapids. Will there be testing made available for consumers and staff as they make plans to reopen? There is an acknowledgement that these are vulnerable individuals. I'm going to have Heather go ahead and answer that question.
This is a great question, so thank you to whoever answered this question. There's not a plan to do testing for reopening for these individuals. What we have been doing, we have been monitoring long-term care facilities and group homes here in Linn County as the COVID-19 pandemic has been an ongoing presence in this community. And so when we start to see issues of illness either within the residents of the group homes or within the staff members, we have conducted mass testing at those times when we did see illness present. We would also encourage anyone that attends these large programs that does not live in a group home but may live at home with family members. Again, if there's any sign of illness, that they do not attend the program, but they would be talking to their doctor and then receiving testing to ensure that they are healthy before going into that program. And for all individuals within Linn County, anyone that is ill, no matter how mild that illness may be, we would ask that they follow the guidelines that have come forth. There have been some changes in those guidelines. So what we would ask for any ill individual is that you stay home until you've been free of fever for a full 72 hours without the use of reducing medication, that you have had symptom improvement, and that it's been at least 10 days from the onset of your symptoms. This is a change. Before 7 days, but the guidance has shifted, and it's now 10 days. So thank you for that great question.
Thank you, Heather. Our next question is, how can a business request testing for employees? This is one that you can start with, and then our medical professionals, you might have additional information, especially if it's through a related occupational health program. So I'll let Heather go ahead and answer that one.
So again, for any business, we want all of our businesses to be screening employees prior to coming into work, which would mean looking for their temperature and also doing a symptom check. Anyone that is ill with a fever or having symptoms such as cough, shortness of breath, sore throat, headache, muscle aches, fevers, should not be admitted to work, but should go home and follow those guidelines for being ill and not come to work until they met all three of those metrics, which again are being free of a fever for a full 72 hours without the aid of medication, symptom improvement, and 10 days from the onset of illness. However, if a business does start to see an increase in employees that are reporting ill to work with COVID-19-like symptoms, we would ask that you either reach out to public health or to your occupational health clinic that you utilize to inquire if testing may be indicated because of an increase in illness. We do not suggest doing mass testing just to see what's going on within your facility. We do have a shortage of PPE, and that would also be burning through a lot of the available test kits and supplies that we have. However, if there is illness circulating throughout the facility, we do want to get on top of that before it becomes a large issue, which we've seen in the media. So if you start to see any illnesses, please reach out to either the Linn County Public Health Department or your local public health department or to your occupational health clinic. And if any of our providers would like to add to that, I would be happy to hear what they'd have to say too.
And Heather, real quick before we get off of this topic, we do have a chat in our chat box with a question about how this would be small businesses report illnesses.
So again, if a small business has any questions at all, please reach out. You can call Linn County Public Health. We're happy to speak with you, kind of talk to you about the numbers that you're seeing, what you're seeing within your facility. We can talk to you about if testing should be indicated. We can give you guidance on cleaning, disinfection. We could also provide some guidance on just some things to think about to help protect your employees, whether that be some functional changes within the workspace or if that is just some guidance on hygiene etiquette. So we'd be happy to talk to you, or you could talk to your occupational health clinic if you work with one on those two. We will be developing some tools that you can use, some guidance materials that will be updated on our website hopefully early next week that we would also point you to, because that may give you some good information too. The reopening we know is happening now, so we want to get our materials together to help our businesses as they try to make those decisions about reopening.
Great, thank you, Heather. Would any other of our panelists like to add anything to this response on how businesses can request testing for employees? Not at this time. Okay, we'll move on to our next question. So the next question is anyone who wants a test for COVID-19 able to get a test? And I will probably have one of our healthcare providers respond to this question if possible. Dr. Ockett, would you like to take this one?
I can speak for the emergency. Yeah. No, we're not testing everybody. If people just come in and request to be tested, we're not testing them. We don't have the supplies to test everybody in the community. So we're pretty much following the criteria that the Iowa Department of Public Health laid out when people come in. So really that's going to be people that are really sick. It's going to be frontline healthcare type people, or people that are older than 60 with chronic medical conditions, or people that are in congregate settings. We're pretty much following that to the T, and we're not offering testing through private labs either. So So we're going to evaluate people, and if we think they need testing, we're following the IDPH guidelines pretty much. So.
Great, thank you. The next question is, what are the symptoms of COVID-19 in children, and how can I get my child tested? Dr. Greenlee, would you like to take this question?
Yeah, I can take this question. So we know with COVID-19 that children are affected at similar rates that adults are. We just know that their symptoms tend to be much less severe, and a lot of kids tend to be asymptomatic. So we don't have the actual numbers of how many children are actually affected because, for one, they may not have symptoms, so it won't prompt them to come to be evaluated or be seen, but also when they are seen, they don't have severe enough symptoms that maybe would prompt us to test them for COVID-19. Symptoms would be essentially similar to those in adults. They could have fever, cough, sore throat. We see some diarrhea and vomiting or GI symptoms in children at a little higher rate than the adult population. If you're concerned that your child may need to be tested for this, we would just encourage you to reach out to your primary care doctor, and they could arrange for them to be seen or determine whether it would be important to be tested or be seen. And kind of similar criteria to what Dr. Ockett had said, severity of symptoms, if they have direct exposures, if they have somebody in the home who's maybe an essential worker or who has chronic illness, they would be more apt to qualify for a test than just a healthy child in a home without any exposures.
Thank you. Just a reminder to our participants on the line, if you have a question, you can use the GoToMeeting chat function to chat that, or you can send an email to lcph.meetings@linncounty.org, and I will be monitoring those. Our next question is, I don't have any symptoms of illness, but I've been around someone who has recently tested positive for COVID-19. Should I be tested? Stacy, would you like to take that question to respond to?
Sure. No, we would recommend that you stay home, monitor yourself for symptoms, and typically the recommendations, if you've had a direct exposure to someone, that you self-isolate for those 14 days. If you do develop any symptoms, fever, shortness of breath, cough, please call your provider before going in to be seen so they can make the arrangements or refer you to one of the respiratory clinics to get tested.
Moving on to our final slide of questions that have been submitted in advance. The next question talks about serology or antibody testing, which has been pretty prevalent in the news, and many people may have questions about that. So what is serology or antibody testing, and is it something I should ask my healthcare provider about? Is this available in Iowa? Julie, do you want to take this question?
Sure, I can. Serology testing is really looking at a person's immune response. So one of the first tests to become available for diagnosing coronavirus was really an antigen test, and that test relied on the sample collected from, the nasal passage. The test detected the virus antigen itself. Serology or antibody testing is really a little bit different from that nasal swab diagnostic test that shows an active infection. It's a blood test, and it's really intended to determine who at some point has been infected by the virus and now could be immune. Antibodies or disease-fighting proteins formed in the days and weeks after infection may protect a person from reinfection, at least for a time, though it's really not been proven whether that holds true with the new coronavirus. So there are two types of antibodies as part of an immune response, immunoglobulin M or IgM and immunoglobulin G or IgG. The body produces quickly IgM at the onset of of an infection, and then it makes IgG antibodies more slowly and retains them longer. That might suggest immunity to the virus. And basically, just to reinforce with what our providers here online have talked about, is that if you have questions about your well-being or your risk of exposure to coronavirus, you should really work with your healthcare provider who can assess if this testing is right for you at this time. So really encouraging you to do that. We do have access through our laboratories testing for antibody here in Iowa.
Thank you, Julie. Our next question is rapid testing for COVID-19 available?
I can answer that if you'd like.
Sure, go ahead.
We don't, here in our laboratory, we don't have like a 15-minute test, but we have implemented a PCR test where results can be provided in under an hour. We have a very limited testing material allocated to us for this particular test, and we're using this in a limited way. Our medical staff really use this test before an urgent aerosol generating procedure when timeliness around this test result is critical. This really helps our healthcare teams know what, if any, additional personal protective equipment or resources we should be using in care for this patient.
Oh, I'm sorry. I just realized I said that and was muted. I apologize. Do any of our panelists have anything else to add regarding the rapid testing?
Mm-hmm.
And then question number 8 is, will insurance pay for testing? What if I don't have insurance? Heather, would you like to answer that one?
So there's a difference between the price for the testing and the price for an office visit. So when we talk about testing, the state hygienic lab, if a test is being processed through the state hygienic lab, there's no cost for that processing of that test. However, if a reference lab was going to be used, there may be a cost associated with that. However, I believe that there has been some federal guidance that most of the insurance companies are picking up the cost of that test. However, that does not always mean that the cost of your appointment being seen would be covered. I don't know if any of our other speakers would like to weigh in on any of that.
Stacy or Julie, do you have anything to add about the question around payment for testing?
I don't have anything else to add other than what Heather already mentioned.
Okay, very good. Thank you both.
Mm-hmm.
So we do have a question that came in through the chat that would like us to provide information about Test Iowa website. So actually, I think this is a good opportunity for me to move on to our slides that then talk about resources. So as many of our Linn County residents know, that recently a Test Iowa site was opened in Cedar Rapids, available for residents in eastern Iowa. We do have in our slides here a link to the Test Iowa website where you can go and get additional information about Test Iowa. I do want to say that if you follow our press conferences, that you will know that Heather provided some information, as well as our emergency management officials and Supervisor Walker yesterday during a news conference. And so feel free to listen to that press conference, or we can answer additional questions, excuse me. But prior to going to that site in Linn County, you do need to go to the testiowa.com website and complete the assessment. That will determine whether you are able to schedule an appointment for their drive-up testing location or not. We recognize that this is an initiative run through the Iowa Governor's Office, and we're happy to support that for our Linn County residents, but many questions, it really is more appropriate for those to be directed to the Iowa Governor's Office, as this is their initiative. Okay. And then just a reminder, if you have any questions for our panelists, you can chat those through the chat function, or you can email them to lcph.meetings@linncounty.org. It is helpful if you indicate who your question is for, so make sure that we get the most appropriate person to respond. I do want to take a moment just to point out that for general questions about COVID-19, you can call 211 or visit Linn County Public Health's Iowa Department of Public Health or CDC websites for more information. Okay. And I think I do want to give an opportunity for each of our panelists to share any information around COVID-19 testing that we haven't already covered. So I might just go through our list here and see if there's anything else, and touch base with our panelists to see if they'd like to share anything. Stacy, do you have any information that we haven't talked about related to COVID-19 testing that you'd like to share?
I don't think so. We just want to continue to encourage people to contact, phone in, call their provider before just coming in. We have respiratory clinics set up that we will direct those patients to get that testing done. To conserve our PPE, those facilities are set up to do that testing, and to not just show up, to please phone in, call the provider first, and get that order.
Very good. How about Dr. Greenlee? Is there anything you'd like to share regarding testing for COVID-19 for our Linn County residents?
I just want to echo what everyone else has said. It's important to be in contact with your primary care provider, and they can direct you to the appropriate place and if it's appropriate to be seen. So I think everything else was covered that I wanted to address.
Very good. How about Julie?
I just want to shed a little hope. We continue to learn week by week that testing material allocations continue to get bigger and broader in scope for our laboratory services. So incrementally, we're continuing to evaluate those different populations of patients that could and should be screened for COVID. So as we continue to move through the summer, there'll be more testing available, and I'm feeling pretty optimistic about that. So we do partner with our medical staff and really look at identifying those next communities of individuals that we can serve, so we can perform the right tests at the right time.
Very good. Thank you, Julie. How about Dr. Ockett? Anything you'd like to share around COVID-19 testing from your perspective?
No, just echo what Stacy and Leslie said. And I think the public's doing a good job. Initially, a lot of people were showing up just to get tested, but they've learned to start with their primary care provider, and that the emergency department's not a testing site. I would like to add, though, that one concerning thing from my perspective is that patients have been coming in with chest pain days later that said they didn't think they could come to the ER before they saw their primary care physician. So I think it's important that people still need to come in if they think they have an emergent medical condition. So
that's a great point. Thank you.
That's it.
Okay. Heather, anything you'd like to share around testing?
I know we've gotten a lot of questions here about the serology testing. It seems like that is getting talked more and more about. So just to add on to what Julie was saying before, with serology testing, it may take anywhere 2 to maybe even up to 3 weeks before we can really start to find antibodies when we're doing that serology testing. So please keep that in mind. If you're coming in right away, there may not be antibodies that have developed yet that we've been able to find. But I want to also talk about why we're doing serology testing, and the Centers for Disease Control and Prevention is doing serology surveillance right now. And so what we're looking for is how much of the U.S. population has been infected with the virus that's causing COVID-19. We're also trying to determine how things are changing over time. And we're trying to also look at the different characteristics or risk factors that are associated with COVID-19 infection. So we look at things such as age, the location where that testing occurred at, and if there were any underlying health conditions. We're trying to determine how many U.S. residents may have experienced mild symptoms or were asymptomatic. And we're also looking to see how many antibodies can be found after a COVID-19 infection. Right now, with the serology surveillance that we are doing, we are not able to tell you how much of the U.S. population would be immune to COVID-19 and are not infected again. We don't know that. We also don't know how many antibodies are needed to protect someone from COVID-19. And we do not know how long someone with antibodies would be protected from it in the long run. We also do not know if you can be reinfected with COVID-19. And we do not want individuals being tested for antibodies as a return to work status. So I just wanted to kind of review why we're doing it and what the surveillance is not able to answer at this time. Hopefully, through time and through more education and more research, we will have some of those answers, but we do not have them right now.
Thank you, Heather. We do have a couple of questions that have come into our chat that I'm going to see if we can get answered. This question states, if someone lives in Linn County but works in a different county at a location where employees have tested positive for COVID-19, do they need to go through their employer to get tested, or can they use a test site in Linn County? So to restate that, it looks like this person may have a workplace exposure in another county, and they want to know what's the best way for them to get tested. You want to answer that one, Heather?
Sure, I can answer that. So if, you know, every work setting is going to be a little different with how large it is, with how many people work there, what that exposure setting looks like. So it's hard for me to say exactly what your employer may or may not be doing. However, if you are exposed to COVID-19, depending on the type of work you do, if you're not considered what they deem an essential employee, such as law enforcement, a healthcare provider, EMS, if you don't work in a group home or a residential setting, if you're exposed to COVID-19, what we ask is that you stay home for 14 days and monitor for signs and symptoms of illness. If you are worried that you may be symptomatic for COVID-19, echoing what Stacy had said before, call your healthcare provider. Let them know that you think you may have been exposed, that you have these symptoms that are occurring, and then you and your healthcare provider will make that decision if testing is indicated or not. And also echoing what Dr. Ockett had said before, if you have any symptoms that could be severe, you're having chest pain, difficulty breathing, your lips are getting a bluish color, please go to the emergency room for care. Do not wait.
Thank you, Heather. A related question to that is, if someone believes they need tested and they do not have a primary care provider, where should they start if they have symptoms and want to be tested? Stacy, could you help answer this question?
Well, we do have urgent care clinics that they could be seen at. Would be my first recommendation is to call one of the urgent care clinics.
And then another question is regarding the testing protocols and the changes, in potential changes in testing protocols. So this person says, has the testing protocol changed? We are an essential food production business. Recently, we have had several employees be approved for testing. 2 weeks ago, this was not the case, and we had trouble getting people tested. Excuse me. So have our testing protocols changed?
So this is Heather, and yes, those protocols have changed. So when we look at the protocols put out by the Iowa Department of Public Health, they have added for people with fever or respiratory symptoms, and I don't have it right in front of me, so I can't say it verbatim, but if you are working in a critical infrastructure setting, you would be able to be tested, and that would include individuals that work at meat packing plants. That is an expansion of what it was previously.
All right, I'm just going to do one more check and see if we have any additional questions come through. I'm not seeing any. I would like to briefly just touch on some resources that are available for people that may have questions. So the Iowa Department of Public Health has a testing framework for Iowans. This may be useful for some people that want to know how decisions are being made on who gets tested and who does not. The Centers for Disease Control and Prevention also has a page on their website dedicated to COVID-19 testing. And then, as I previously mentioned, Test Iowa is an initiative in Iowa through the governor's office, and a Linn County site opened yesterday, Thursday, May 7th. And you can go to testiowa.com to take the assessment, and there is also a link to the frequently asked questions for Test Iowa if you have questions about that process. I am just checking for comments here and seeing none. I'm going to move us along to our last slide here. So I do want to again thank our presenters for providing information and answering some questions on COVID-19 testing today. These are very busy individuals, and we're very grateful to have them take some time out of their day to answer some questions and provide information to our community. Linn County Public Health has been hosting town halls weekly. We will have a planned topic to discuss next week on reopening safely in Linn County. As we know, some organizations and businesses are considering what it looks like to reopen for additional operations. We will provide additional information on that topic and when it will be as that date gets closer. Thank you all for your participation in today's virtual town hall, and I am going to go ahead and end our meeting. Thank you very much.
Thank you.